If you think that your patient has Chiari malformation or has symptoms of Chiari and you want to refer them to neurosurgery, listen up. So one of Dr. McLaughlin's specialties is Chiari malformations. I'd say it's probably like more patients are treated conservatively than they are with surgery, but the patients who come in for a surgical consultation usually have to wait like 1 or 2, 3 even sometimes appointments to get the proper workup that Dr. McLaughlin's going to explain. Chiari malformation is caught by a primary care doctor incidentally. So oftentimes Dr. McLaughlin can treat these with conservative treatment or therapy, but sometimes he needs to operate when a patient fails all conservative therapies and the pain is just like unbearable. I would say 90% of the time, the patient doesn't come with the correct studies done for Dr. McLaughlin to make a call. Can we do this conservatively or can we just like proceed with surgery? So we wanted to make this video for like internal medicine or neurologists. If a patient comes to you and you want to like refer them to neurosurgery, please make sure, at least Dr. McLaughlin's going to explain, that you have this proper workup. It just makes everyone's life easier, saves a lot of time and money and insurance and visits to radiology.
I have a lot of patients that come into my office with a Chiari malformation and they're incompletely worked up. Oftentimes this is because the Chiari is picked up incidentally on a cervical spine MRI scan. But for anyone who's in primary care, let's say that you have a patient that has a newly diagnosed Chiari malformation, either you get the MRI scan report back and it says low-lying cerebellar tonsils, remember that it's really important to order, in addition to the study that you have of the cervical spine, it's really important to order a brain MRI scan because we want to look for hydrocephalus and look at the craniovertebral junction in a more detailed fashion. And we also need to look downstream, below the Chiari, in the thoracic spine to see if there's a thoracic syrinx. So Chiari malformation workup includes brain MRI scan, cervical MRI scan, and thoracic MRI scan.
And do you need contrast for those studies?
No.
Okay.